Hi, I'm Emily Moore, naturopathic doctor. I want to talk to you today about hand-foot syndrome. Hand-foot syndrome is a chemotherapy side effect that causes pain, redness, and swelling in the hands and feet. And as naturopathic doctors, our goal is to incorporate lifestyle strategies and natural medicines to reduce or minimize this side effect. So first of all, to understand why hand-foot syndrome occurs. When chemotherapy leaks out of the very small blood vessels in the hands and feet called capillaries, that chemotherapy can irritate the skin and tissues in the hands and feet. So this can cause pain and swelling and redness and peeling, and sometimes if it gets severe enough, patients have trouble walking. At times, chemotherapy may have to be discontinued because of this side effect. One of the first strategies I always talk to patients about is to try to keep the hands and feet cool. So if you have really warm temperatures in your hands and feet, those little capillaries, those blood vessels are going to dilate, and that's going to make the blood leak out even more into the surrounding tissues. By keeping your hands cool, you can actually constrict those blood vessels, pushing the chemotherapy away from the skin of your hands and feet. A couple strategies to do this: if you're getting chemotherapy by an IV, bring a stainless steel water bottle filled with ice water and hold on to it every now and then to get that coolness across your hands. You can also try something like an ice pack or a bag of frozen peas, or even just running your hands under cool water periodically, not just during your infusion, but also for a couple days afterwards. The other thing is that you really want to avoid getting your hands too warm, and that's because to further dilate those blood vessels, you're going to have more of that irritating effect on the tissue in your hands and feet. So try to avoid hand washing dishes in really warm water. Try to avoid wearing shoes or socks that aren't going to allow your feet to breathe. And always try to rinse your hands and feet in cool water after you exercise. If you're getting your chemotherapy by a pill, then it may be a good idea to have a regular routine of every time you go into the bathroom to rinse your hands and feet in under cool water, just to keep the hands from getting too warm. One internal recommendation that we often recommend is taking a little extra vitamin B6. Vitamin B6 may help to minimize the severity of hand-foot syndrome and is an easy vitamin to get in supplement form. We don't recommend getting extra B6 by increasing the number of pills you're taking of a B complex or a multivitamin, because then you might end up getting too much of other nutrients like folic acid. So this might be contraindicated with your treatment, and so we recommend just getting it from the plain B6. My favorite topical therapy for hand-foot syndrome is CamWell's Hand to Heal cream. This is a Chinese herbal cream that soothes inflammation in the skin layer and helps with healing. I always recommend patients use this cream from the very beginning of the course of treatment if we expect that hand-foot syndrome will occur. Some patients choose to wait until the symptoms do start to appear, and it still seems to be effective in those cases. I've had patients in my practice who love this cream so much that they've reported that even after one application, they've noticed increased healing or less peeling, as well as reduced symptoms of neuropathy. So for more information on what I've just discussed here, to hear about dosing for vitamin B6, and to learn about potential contraindications for your specific chemotherapy regimen, please download the patient care handout called Hand-Foot Syndrome on the CamWell website. Thank you.